Hello everybody, Chris from the Headache and Pain Management Centre here, talking today about an interesting topic, a question that we get quite a lot coming through the comments and through the email, talking about why sometimes hospital pain courses aren't as effective as what they could be for chronic pain patients. We've seen quite a number of patients that have come through our clinic over the years which have had the chronic pain courses through the hospitals. I just thought I'd share a few things as to why, for those patients in particular, things didn't quite go so well. If you are joining me, just type in below, say hello, and if there's any questions that you're going through, please feel free to ask and I'll answer them for you. So yes, as you can see, I'm here at the office at home. I've got one more day off before I go back to work tomorrow, and I thought, yeah, while I was sitting here talking about why often these hospital-run pain courses can sometimes go awry, and it's obviously not their fault. Like they're doing the best that they can. Some of these hospital courses are actually really, really good. It's multidisciplinary. There's a whole number of different professionals that are there. So from physios, doctors, exercise physiologists, pharmacists, dietitians, they've got the works that are going on there. So it can get a bit exy when you're doing it. However, what happens when it doesn't work, or why can't it gel sometimes for some people? We do know that there is quite a lot of success for people that do these courses, but sometimes it fails. So today, look, I thought that I'd just talk about why these things do fail at times for people when they go through these courses. And the number one reason for it is actually because of the setting. It's because of the setting. Now, what I mean by that is that most of these courses are run in a group setting, okay? And the most important piece of material for people to learn about when we're talking about those chronic pain courses are, where is my pain coming from? Like, what is it about my pain? What's causing it for me? Why is the pain happening to me? Now, when they're educating these things, what they're saying at these pain courses is absolutely correct, okay? Namely that the pain is an output from the brain, okay, in that it's a signal that comes up from your body, gets interpreted by your brain, and then basically end user experience is pain. However, when we're talking about a concept just as complex as that, and that may be the first time that you've heard even that sentence, so if there is any questions on that, I'm happy to sort of expand more on that. When you hear that for the first time, quite often patients can actually take the wrong message, and it doesn't feel great because it sounds like what their doctor and what their educator is saying is that the pain is all in their head, that they're making it up, and that it's not as important as what they're making it out to be, and basically that they're going to have to live with it forever. And it's about having all these management strategies that they can try to actually just cope with these sorts of things. So when you're starting off a course in that sort of way, where the whole thesis of the course, or the whole point of it, is to change the belief systems and thoughts around how pain works, if it's not delivered in the way that you as the consumer is understanding, then it's actually really, really easy to get to misunderstand the message. The thing is with group settings, and the thing is when we're talking about very complex things like chronic pain, or complex concepts at least, is that we need to make sure that the message is delivered in an individualized way, so that you're walking out getting the right message at the right time from the right person. And what we find with most people that come through the door that have been through the chronic pain cases before and get results with what we do, is we're actually sitting them down for quite a long time, and sometimes it can be 3 1-hour sessions to actually just work through, firstly, how pain works, secondly, get rid of the fear that's talking about the pain, and thirdly, giving them strategies that they can use to work out and work through those fear avoidance activities. So quite often people are very afraid to move their back, they're very afraid to turn their neck, because they're afraid what's going to happen is they're going to make their pain worse, and they're not actually understanding how complex it is when it comes to how pain operates. The other thing that can happen is that they may have missed something obvious. And we have seen this a little bit. So generally for headaches and migraines, it's the top of the neck. They're not considering the movement and the or the inputs that are coming from the top of the neck and causing headaches and migraines to happen. And for low back pain, it's actually the brute strength that you can actually generate from the muscles at the bottom of your back. They're the two most common things, obvious things that physically can be missed. And quite often getting those sorted out actually gets the job done as well. So when we're talking about pain course at hospitals, there's there's nothing but evidence-based stuff that's happening there. So I want to be very clear here. I'm not denigrating or putting down the work that the doctors at the hospitals and all those other health professionals are doing, because the work they do is absolutely sensational, especially when there's things pharmacologically. So when there's painkiller addictions, when there's addictions to opioids and things like that, they are very, very good at being able to handle those sorts of things. But when it does fail, the biggest reason it fails is because the person taking the course has generally taken the wrong, either has taken the wrong message out of it about what pain actually is for them, and it's not explained in a way that they're able to understand. Just remember that when you're in class, when you're doing these pain education classes, it's like being back in your primary school or high school. There are different levels of being able to learn. Some people learn by doing, some people learn by seeing and reading, and some people learn by hearing, and some it's a combination of all of it. So if it's not being delivered in the right way for you, then it's going to feel like a complete waste of time, even though the message and the information is absolutely correct, but it needs to be delivered in a way that is individualized to you. So that's why basically when I opened the Headache and Pain Management Centre over 6 years ago now, the way that I went about doing it is to actually make sure that an individualized treatment approach is key. So the biggest thing now in physiotherapy and healthcare in general is the concept of patient-centered care. That's basically making sure that the patient understands what the diagnosis is, why they have the pain or why they have the dysfunction or restriction that they're coming to report you for. And the second thing is having a treatment plan that's there, that's individualized and tailored to them based on their own learning ability, whether they're visual, auditory, or doing learners, making sure that basically there is opportunities to ask questions, opportunities to review how things are going, opportunities to make sure that they're on the right path. Because what can happen with these group type scenarios, with these hospital-based programs at times, is that it's very much, I hate to say it, but there's sometimes cookie cutter, and it's the same delivery for everybody, where it's a catch-all and it might help maybe 60 or 70% of people, but there's 20 or 30% of people that aren't getting the help that they're needing because it's not actually hitting them between the eyes. It's not actually getting to the root cause of their individual problem. And as we know, when it comes to pain, it's not necessarily just a physical thing either. It can be a lack of understanding. It can be a psychological or emotional problem. It could be a social problem. So we talk about the concept of the biopsychosocial model in that regard. So when we're talking chronic pain, it is complex. It's difficult sometimes to get your head around, and it can be quite stressful for the person who is suffering with the pain to know what the right thing to do is. The best thing to know is that the best thing for you is the best thing for you. Okay, the best thing that's individualized for you, the best treatment plan that's individualized and tailored just for you to get the best results. So if you have been through those programs before, don't give up. Okay, don't give up. There are ways and means to get better. There are ways and means as we're learning more and more things to improve. And there are ways and means for you to get some improvement. The best ways to improve are all the basics: to move well, to be strong, to be confident with your movement, and to have really good knowledge about what is causing your pain, and to have access to the right people to ask the questions when you need to get the best outcomes for your pain, and to get back to doing the things that you want to do when you are wanting to do them. I hope that's helped. I hope I haven't confused the issue more. If there's any questions about anything that I've said, I know that I've gone pretty deep today. Please type in below and ask a question, or just get in touch with us via private message. Just press the message button on our Facebook page there, and I'm more than happy to get in touch with you to talk about what we may be able to do to help, and to answer any questions that you might have about this Facebook Live video. So yeah, comment, share, like, and comment below if there's anyone who you know might find this useful. And I'll be back on Friday with another Facebook Live video from a different city, actually. I'm at a conference, and I'll be interstate doing a really good Facebook Live video from there. A couple of professionals, actually, from interstate as well. Hope that's been useful, and I hope you're having a good Wednesday, and I'll talk to you again soon. Cheers and bye for now.